Prostate cancer is the second leading cause of cancer deaths in American men, only behind lung cancer. But most men diagnosed with prostate cancer do not die from it. More than 2.5 million men in the United States diagnosed with prostate cancer at some point are still alive today. Dr. Amir Lavaf at Desert Regional Medical Center tells us about screening tests.
The prostate is a gland that's located between the bladder and the penis, and it's just like any other glandular tissue like breast or anything that's found in the colon or rectum. You can have malignancies, and this is basically a malignancy of that gland. One of the things with prostate cancer is that you don't develop symptoms until they're too late. So fortunately, we have developed screening, so most patients don't get caught with symptoms anymore. They get caught through the screening process. In the 80s, we developed a serum test, so prostate-specific antigen, PSA, and that has now been the standard of care in this country. It's a simple blood test that your physician does, usually after the age of 50 or 55. If you start at age 55, you can have a PSA drawn either yearly or every 2 years. And it's not just the number that we're looking at. There's another component of it called the free PSA. You're looking at how fast it's rising, that's called the PSA velocity, and also about the PSA density.
Dr. Lavaf gives some important points when going in for a PSA test.
So before you go for your test, your physician should know that if you had sexual intercourse, if you had trauma to the prostate, such as bike riding, if you had a prostatic infection, all of these will cause a rise in PSA, which is unrelated to prostate cancer. So that's why in certain scenarios, you will have a high PSA, and then on the next test, it'll be low. And even if you have just one result that's high, it should always be repeated. If your PSA is high, the free PSA is low, and other factors bring up a very high suspicion that this person may have prostate cancer, the next definitive test is a biopsy. And it's either done by an ultrasound with a urologist or through an MRI. From that biopsy specimen, we can tell you that you have prostate cancer and what is the grade. A patient that comes to me that has a very low risk prostate cancer, the main thing that I'm going to be doing for that patient is just active surveillance. Active surveillance means that we're going to be following the PSA, and maybe every 2 years you might get another biopsy to see has the cancer mutated, gotten worse or more aggressive. If it hasn't, we won't intervene.
What are the treatment options for prostate cancer?
There's actually two main treatment options. One is surgical, which is a prostatectomy, and then the others involve radiation. Now with radiation, there is external beam radiation, in which you're getting radiation from the outside with a machine focusing on the prostate gland, killing the tumor. Or there is something called brachytherapy. Now brachy just means close. So by brachytherapy, we're implanting the radiation sources into the prostate gland. So it's radiation from the inside out. As far as prevention is concerned, it cannot be done with either vitamins or selenium, which is the studies that we had previously done in the last decade. However, a drug called finasteride has shown to decrease the incidence by 50%. And patients who take finasteride are usually taking it for a condition called benign prostatic hypertrophy. Now, it must be remembered, though, that prostate cancer is a cancer that affects 1 in 7 American men, and it is usually a cancer that you die with, not die of. The 5-year overall survival is above 99%. Now, why is that? It's because of all of the screening that we've been doing and catching it early. So if you have local disease, you have 100% 5-year survival. If you have regional disease, you have 100% 5-year survival. The only time where the survival drops from those numbers is either you have distant disease, so stage 4, it's already moved to bones or other sites, or if you were not staged. So all of this, prostate screening, management, everything, the more we know, the better we can manage it.